Hello, hello. Welcome. So many people coming on here. This is so fantastic to see. I know we have a lot of people signed up for this webinar, so it's so great to see some couple of names here I recognize. But so many people that are new to me, which is fantastic. Welcome and thanks for taking the time out to join us tonight. We are going to get started pretty much on time on the hour. So hopefully we'll see a lot of people come on, but I do want to, be mindful of your time and not spend a lot of time waiting for everybody to come on because we do have a lot of people coming on right about now. Um, can everybody hear me? I see some oh, I have to cough. Okay, people can't hear me. Okay, good. Okay, a couple people can't hear. Let's see. Bridget, can you hear me? I just want to make sure everybody's having. Let's see. I think we're good. Yep. Okay. Good. Good. So yeah. So if you're having any trouble joining us, if you can't hear the sound, just go out and come back in because it's usually a Wi-Fi issue. So, I've got some more issues with people that can't hear. But again, just maybe put that in the chat there, Bridget, to get people to go back out and come back in. Because obviously you can't hear me saying that. We're just about to go on. So, we'll get started here pretty soon, but I'll just wait a little bit more to get more people on. Awesome. Okay. Josie is back. Yay. Okay. And a lot of people obviously want to hear about belly fat, and that's going to be definitely the focus tonight. But I'm also going to talk about some hormones related to this belly fat, talk about fatigue a little bit. Some more people with no sound. Just got to go out. Maybe put that in the chat there. Uh-oh. Few more technical issues happening here. But just so you know, this recording will go out to everyone after we finish up here tonight. So if you're having any issues hearing or something happens with your Wi-Fi, you'll get the recording that will come out for you. Let's see. I'm going to look in here and see who else is in here. Yes. Hi, Terry. Hi, Joyce. Hi, Don. Hi, Katie. This is great. Fantastic. Okay, I'm going to go ahead and get started. Seems like a lot of people are on here now. A few more joining right at the hour. So, obviously, if you're here, you're interested in belly fat, hormones, fatigue, especially with the belly fat, because that's really what we're going to talk a lot about tonight is belly fat. I'm sure you may be dealing with this. You're not sure why. We're going to talk about that a lot tonight. And we're certainly going to talk about what are the things that you can do about it? We're going to cover all these underlying causes of belly fat and talk about how to most effectively address it and how to get results. So, let me tell you a little bit about myself. And why I'm here this evening. So, my name is Dr. Jennifer Stagg. I'm a naturopathic physician. Our practice is in Avon. We opened our practice, my husband and I, about 15 years ago here in Avon. And over the years, we've seen thousands of patients and many of them with very complex issues, multiple health problems. And fortunately, we've been able to help so many people. And I can't tell you over those years how many times, and especially in the beginning of my practice, how many times patients told me, why don't more people know about this type of medicine? And, I really wondered why myself, and I agreed. So then I, essentially made that my mission is to find a way to reach more people than I could reach just on my own, seeing patients one on one. So we expanded our team of healthcare providers. I'll introduce you to them here in a second. And that allowed us to serve more people. But then I started speaking and educating other healthcare providers. And I've written 2 books, all with the goal of reaching more people. And one of the more common issues that I hear from people are, about weight gain and belly fat. So, although I've written about this extensively, especially in my last book, I, of course, am still driven to serve more people and get this message out. So, here I am with all of you, and that's just what we're going to cover tonight. Let me introduce you to our healthcare team. So that's me, and then my husband, Dr. Mark Stagg, who's a chiropractic physician, Dr. Ayla Clark, who's also a naturopathic physician, and Dr. Karen Bender, both fantastic naturopathic doctors. They're doing amazing things with our patients, and really really good results these doctors are getting. Looks like we've got a lot of people on, so that's fantastic. Let me go over what we're going to cover specifically tonight. So, why belly fat is so bad for your health. So, there's more to belly fat than just vanity. That is something that I'm always concerned about in my patients, and there are ways to measure that, which we'll talk about tonight. Very specific ways to measure that. I'll go over underlying causes of excess belly fat, also help you understand the impact of insulin resistance. That might be a new term for many of you, but I'm going to talk about that quite a bit. Address adrenal dysfunction, cortisol. A lot of people know about cortisol. That definitely contributes to belly fat. Also discuss the effects of sex hormones on body composition, and then I'll let you know how to get a free discovery call at our office, or how to book an appointment if you're ready to take charge of your health and tackle this once and for all. Interestingly, tonight we have even another perk. We're going to let you know how to get a free body composition test at our clinic. So hold on till the end, and we'll let you know how you can get one of those. So here's a little nutrition cartoon. You're fat, but you're good fat. This, unfortunately, is not true about belly fat. So, most of the belly fat you're dealing with is what's called visceral belly fat. So, this is fat that sits between, under the muscle. So, there's subcutaneous fat that sits in front of the muscle, and then there's this visceral fat that cushions your organs. That's most of what we're dealing with when it comes to belly fat. The subcutaneous fat doesn't cause the health problems that this visceral fat causes. And here are some of the associated risks of visceral adiposity. So that visceral fat that, under the muscle wall of the abdomen. So very much associated with cardiovascular disease, also type 2 diabetes, high blood pressure, alterations in cholesterol and triglycerides, definitely associated there. PCOS, that's one of actually, it's the most common endocrine or hormonal issue in women. We also do know that visceral adipose tissue is associated with cognitive decline, Alzheimer's disease, also osteoporosis, sleep apnea, something called sarcopenia, which is loss of muscle mass, and then osteoporosis or fatty liver. I think I mentioned that one already. So those are all significant risks associated with this belly fat, and that's why it is a concern when a patient comes to me and they maybe are coming to see me about their thyroid, and they might just note, "Oh, I'd like to lose some weight as well." And we will do what I'm going to talk about here momentarily, a body composition testing, which helps us identify how much visceral fat is there. And then that becomes a concern for me because I know about these health risks. And as a naturopathic physician, we're always concerned about prevention. So we do definitely focus on helping patients lose that belly fat. This is a fat cell, adipocytes. That's what the medical term is for a fat cell. And so these fat cells in obesity, and we'll go over what that definition is because there are specific criteria for obesity. But these fat cells, when there's increased visceral fat, there's an increased load of these various hormones and chemicals, these chemical messages of inflammation like IL-6 and IL-10. These fat cells also produce estrogen. So estrogen is something we'll talk about a little bit later. Estrogen has somewhat different effects based on whether you're premenopausal or postmenopausal. The impacts and pathways can be a little bit different. The other hormones that can be released from these fat cells are hormones like resistant adiponectin. We'll talk about adiponectin is something that you can test on blood work. That's something that I'll often order, or leptin as well. Um, and this excess body fat, you might already be gathering why it is so critical. What it comes down to is inflammation. So some of those chemicals that I just mentioned, these little chemical messengers that float around kind of in our body through our bloodstream and in the tissue spaces, they are mediators of inflammation, and it almost becomes a vicious cycle. So you are have gained this excess fat, and then the fat cells are secreting these inflammatory signals, and then the inflammation keeps going and going, and that's interferes with your ability to lose fat. So then you also have to be tackle inflammation, which we'll talk about how to do that. But arguably the number one driver of chronic inflammation is excess body fat. So there are tools to help, you know, dampen the fire of inflammation in terms of nutritional supplements, specific dietary signals, very important. But also this ability to burn that excess fat that sits in your abdomen, that cushions your organs, that acts like its own organ of inflammation. That's a really important factor. So if you're not shedding that belly fat, you're always up against this excess fat. And, it doesn't all have to disappear, but if we can reduce the load of belly fat there, we'll find that the overall inflammatory load comes down. So inflammation, many of you may be aware, is an underlying factor in most of these chronic diseases that we deal with. Chronic inflammatory disorders, we think about things like that should be IBD, irritable inflammatory bowel disease, pancreatitis, psoriasis, COPD. Various diabetic complications are the result of chronic inflammation. Metabolic disorders like fatty liver disease, metabolic syndrome, chronic pain conditions, osteoporosis, rheumatoid arthritis, fibromyalgia, even mental health disorders now associated with chronic inflammation and inflammatory component. Conditions like depression, bipolar disorder, schizophrenia, neurological disorders as well. I've already mentioned that related to excess belly fat, and the inflammation ensuing from that can increase your risk of developing Alzheimer's, having dementia, developing Parkinson's disease. There are some genetics obviously involved in that as well. Also cancer, and of course cardiovascular disease, all can have this underlying chronic inflammation component to it. So, speaking specifically about cardiometabolic risk, when there is excess belly fat, a lot of times we will see an association with various outcomes on blood work. So, if you're being told that you have high triglycerides or you have high glucose, a lot of people won't know they have high insulin because it's often not tested. Routine lab screening will pick up, on your annual physical, will pick up glucose, triglycerides being elevated, will pick up some inflammatory markers like CRP may be used. But to get more specific, testing for insulin is something that we really routinely test. This condition, metabolic syndrome, is a set of criteria that need to be met in order to diagnose metabolic syndrome. So that you need to meet 3 of 5 criteria, some of which are on here. So elevated glucose, elevated triglycerides, low HDL, high blood pressure, and then an increased waist circumference. We'll go over what that waist circumference is on a later slide. But this all ultimately leads to a significantly increased risk of cardiovascular disease, developing plaque in the arteries. And obviously, that visceral adipose tissue, that fat sitting in the belly, is responsible for that cascade. We also know that depending on your actual categorization of being either non-obese, but obese with low intra-abdominal fat accumulation. That's what I was talking about, whether you can actually be overweight, but some of that fat can just be sitting outside the muscle. So it's sitting on top of your belly. It's more subcutaneous. That does elevate your risk of having, or it's associated with having higher level of glucose. That's the little graph you see there on the left. So the green would be not in a non-obese patient, and then the yellow boxes are in a patient who, or person who has this more subcutaneous profile of fat, not the visceral fat. That does associate with elevated glucose and also with insulin, as you can see on that graph on the left. If the fat is significantly accumulating in the visceral compartment, then glucose will be even higher, and you can see that insulin even higher than that. And that's when we see insulin resistance. Insulin resistance is quite common, as is prediabetes. Insulin can be measured in a fasting blood sample, and we're looking for elevation. It should really be under 5 as optimal. The labs will flag it as high when it gets over 17, I believe is where it is now. But certainly if you were coming in over 5, we see that as being a concern, demonstrating some degree of insulin resistance. I have had patients that have come in the high 30s and even slightly above 40 on insulin. And when that happens, obviously we need to get on work through a very personalized dietary program, nutrition program, incorporate physical activity, stress reduction, which we're going to talk about. But also, there are very specific nutritional supplements that can help with insulin resistance, very unique substances that can help with that. One of which is berberine, which has been shown to be effective for helping to lower glucose and improve insulin resistance. It's a fantastic herbal supplement that we routinely use in our practice. As I mentioned a little bit ago, the fat cells that sit in your midsection. So a lot of times we think about women as being either an apple or a pear. So when the fat sits down around your hips and in your thighs, it's more of a pear shape. That's not, I didn't get a slide in here with that as a pear shape, but I'm sure most of you women understand what pear shape means. The apple shape, more of this android appearance where there's a loss of basically your waist, and so the belly fat is increased. That will be associated with an increased level of a hormone called resistin, and that is important in the insulin pathway and increases the risk of type 2 diabetes. It also, these adipocytes, these fat cells, when in this apple shape or android body type, there's also a decreased level of a hormone called adiponectin. That adiponectin we can test, and leptin also. Those hormones can show us some additional information about whether you've become leptin resistant and have issues with adiponectin. And there can be some genetic components to that. So we also do genetic testing, and sometimes that will show a disturbance or a genetic variation that increases your risk. So for some women and men, there can be genetics involved here as well. So I do want to point that out. This is not all just a matter of lifestyle. Lifestyle certainly impacts your genetics, but sometimes there's a strong genetic component to it, and you'll know that you really seem to be doing all the right things and not getting the results. Now, sometimes it's just we have to tweak those things. So certainly getting the right nutrition information is important. But there are hormones like adiponectin, like leptin, like insulin that I've already been talking about that we can address with specific supplementation and specific dietary strategies to help improve the hormone profiles there, and that can augment the ability to burn that fat mass. So how to accurately measure belly fat? We used very high end technology called an in body machine. It's body composition testing. So, in this evaluation, it's very simple. You're basically just standing on a machine, barefoot, holding on to those little bars that you see there on the side. It gives us, it's obviously gives you your weight, but it also has algorithms where it can calculate your muscle, your total body fat, as well as sectional body fat. So when we're thinking about body composition, we really want to know how much of that body composition is made up of fat versus muscle. We can also get visceral fat, actual number for visceral fat in there. It calculates your basal metabolic rate, which helps us, which allows us to better advise you on how many calories you should be consuming in your diet. It does give us fluid distribution, so it gives us information about water as well and the distribution between the inside the cell and outside the cell. So indirectly, we can assess for inflammation and impaired cellular membrane function. Sounds a little bit technical, but there are strategies that we can use if we find some of those disturbances with fluid distribution to help improve the cell membrane function. And those can be simple things like increasing the amount of fish oil, increasing the amount of what we call phytochemicals. So, all of those like wonderful chemicals, pigments that we find in vegetables and fruit and beans and nuts and seeds. Those sometimes we'll use a greens drink or a reds drink. It is a powder of, big punch of those phytochemicals that can help with the fluid distribution and help reduce inflammation. So when we do this in body, we get this report, patient takes it home with them. And not only do we obviously get this measurement of weight, but it gives us so much more information. So we can then find out, is there a lack of muscle mass? Do we need to really be on a really targeted program to build up that muscle, because increase in muscle mass can increase your metabolic rate, which can help you burn fuel more effectively. And then certainly that muscle, having more active muscle, will contribute to overall metabolism and helps improve insulin resistance. So that metabolic component can also be addressed through enhancing that skeletal muscle. We can directly assess body fat. We can see what's called the segmental fat analysis. So we can actually look and determine where the fat percentages are and how much over they are, even in your right arm versus your left arm, your midsection, the legs. And we can also determine muscle mass. So sometimes I'll have patients who are really into fitness, doing CrossFit competitively, or really, bodybuilders or fitness pros who are coming in to do the in body because they're interested in their segment lean analysis, which we can also find out here on muscle. But it's also great to see, even when we're on a fat loss program, to look at that lean analysis and make sure we're building that muscle back up, which is really important for your overall health. So, as many of you probably are aware, muscle weighs more than fat. Fat takes up more space, but sometimes uncommon, but sometimes what I will see is that someone is in the BMI, now body mass index, these BMI criteria, which I'll go over here in a minute. These BMI values could put someone falsely in an overweight category because they have so much muscle. And that this type of testing allows us to better understand whether it's muscle or fat contributing to that actual weight on the scale, which is really important here. And perhaps for some people who do work out a lot, also genetics involved here. There may not be as much fat that we need to burn off because there's so much muscle there accounting for that actual weight on the scale. So here are those categories for determining if if we're just doing weight, which I also take into account that BMI is calculated there, but you can go online and do a BMI calculator, and this is just a calculation based on your height and your weight. So normal range is between 18.5 to basically 25 would be a healthy weight. If you're coming in under 18.5, that is underweight, and that's associated with its own health risks. Overweight is categorized as 25 to 30. And then over 30 is obesity. And then there are also designations of levels of obesity here. So coming in at 40 is class 3 severe obesity. And I've definitely worked with plenty of patients who are coming in at over 40 on their BMI, and we can get great results with that. It's a longer road, but a lot of times to start, there's a rapid amount of weight loss when your weight is that high. But certainly, we have experience working with that as well, and can see really great results there. So waist circumference, which I'm just going to pop ahead to, and I'll come back. I'm going to pop ahead to this slide where I'll define this waist circumference. So an elevated waist circumference is over 35 inches for women, and it would be over 40 inches for men. So these are the current recommendations that are shown to be associated with increased risk of cardiometabolic disease, meaning having some issue with diabetes, elevated blood sugar, elevated blood pressure, building of plaque, risk for myocardial infarction or heart attack or stroke. These are the numbers that you're looking at. So you can do a waist circumference at home. You can actually just take little measuring tape and you just want to run it around like the biggest part of your belly, just underneath your belly button. And you can get that measurement. And that's something that you can track over time as well. That's a good trackable when you're on a really good comprehensive personalized program that you can track waist circumference. So that's another way beyond just BMI. So if you're not don't have access to an in-body machine where you are, or you can use waist circumference and BMI as well. And what I do want to say about that is that 54% of adults have that elevated waist circumference that is associated with elevated risk of cardiovascular disease and diabetes. This is more of an issue for women. So almost 65% of women have a waist circumference over 35. And this is why there are such strong awareness programs for cardiovascular disease in women, because you can see how many of us are at risk of elevated, at risk of having heart attack, stroke, developing diabetes, less in men. And we'll talk about hormones a little bit, but the testosterone and estrogen balance do definitely contribute to waist circumference. Women in general tend to suffer from more stress than men as well. I don't want to minimize the impact of stress on men because I certainly see plenty of that, but women tend to have more issues with stress burden and cortisol burden. Um, so let me get ahead here. Whoops, I skipped this slide. Other ways to measure whether this, what I talked, android body composition, this apple shape, whether there could be some risks associated with that, or I mentioned insulin. We talked about waist circumference, but also blood pressure can be associated with that. There's a measurement also called hemoglobin A1C, which is a measurement of your long-term blood sugar control. Optimal is 5.5 on that. Anything over 5.7 is going to be flagged as high. Triglycerides, when they're elevated, would be, and can be associated with the elevated waist circumference and more belly fat. Also, on a standard lipid panel, you can do a calculation on your own. It doesn't come back on the actual panel. That number won't be there, but I often just do it, on my calculator, measuring a triglyceride to HDL ratio. So you basically take those triglycerides, divide by the HDL, and what you're looking for is for those numbers optimally to be about the same, to be that they're 1 to 1. If it is above 1 to 1, then the risk goes up. But if it's 4 to 1, the risk is very significant of having being at high risk of a cardiovascular event. So if your triglycerides, so say you're running an HDL that maybe is a little bit lower at 40, and then your triglycerides are 160 or above, then you're hitting that 4 to 1 ratio. And we do see that quite a bit. So that is something to definitely do on your lipid panel to check out and see where you are on that. That's something you can kind of look at on your own. And then the strategies for addressing belly fat will come in really importantly there. That's the slide I just reviewed. Let me get ahead here. Okay, so if you are just joining us, we've been talking about why belly fat is so bad for your health. We've been reviewing some of the underlying causes of excess belly fat, some of these hormones that are involved there, talking about insulin resistance. We're going to start talking about adrenal dysfunction here soon, and also discuss the effect of sex hormones on body composition. And hang in, because we're going to let you know how to get a free body composition test in our office here pretty soon. So we did already talk about insulin, as I said. Cortisol, estrogen, and testosterone, I do want to talk about next. Cortisol, I'm going to spend a good amount of time talking about. So as I mentioned, stress is a significant burden that a lot of us encounter. And 75 to 90% of all primary care visits in the United States are due to, in some way, overexposure to these stress hormones. 6 of the leading causes of death are also associated with stress: heart disease, cancer, lung conditions, accidents, of course, cirrhosis, and then suicide. Now, what I do want to say about stress that comes in to be really important when we are evaluating the whole case in our practice. We always look at the whole person. So we're thinking about mind, body, and spirit as well. That if you're under a lot of stress, it's going to be difficult to make change, first of all. So people will tend to eat poorly, have trouble committing to a healthy lifestyle program, could be abusing alcohol or drugs. Um, and when this is the case, we need to get that stress response managed more effectively, or obviously, we're not going to get very far with a lifestyle program. It'd be difficult to exercise, it's difficult to choose the right foods, to cook some healthy foods. So we really do really need to address stress, the stress response. Some forms of stress that people encounter, majority of the time we see it's emotional stress, but even lack of sleep is a form of stress as well. Exercising too hard, a lot of people don't think about that, but that can stress the body. That needs to be a very high level of exercise, like not doing like CrossFit, Beachbody. These programs are great. They're not that, I wouldn't put that in the category of exercising too hard. This would be excessive exercise. And then there can be nutritional stress as well. With the sleep, I'll talk a little bit about that here in a bit, but sleep is often related to stress and a cortisol dysfunction as well. Now, as I mentioned, if you're under a lot of stress, it can be difficult to make change and get in the habit of following these lifestyle changes. But on their own, like being under stress can cause elevations in cortisol and adrenaline, which can contribute to increased heart rate, which is not good for you. It can also increase your glucose level. So in your liver, your glycogen, glucose stores get converted to glucose. You can have increased circulating glucose. It can increase your blood pressure, decrease like digestive function, which can contribute to issues. I didn't really do any slides on the microbiome and digestive dysfunction. Talk a little bit about it, but that also can be related to belly fat, that we do look at digestive function as well. Oops, went too far. Okay, sorry. Okay, here we go. So everyone's stress tolerance level will vary. So you may know someone who is under a tremendous amount of stress, but they're managing it okay. And that can be because of genetics, of course. It could be environmental in terms of the social skills that they've required acquired during their life, their coping mechanisms, their support systems, even their occupation. If it was a low stress occupation, then maybe they have an easier job dealing with the personal stress in their life. But someone else may have a really high stress occupation that's contributing to their stress, or genetics. And that is something, again, I'll mention that we can test, and there are specific genes associated with stress tolerance that have been identified. And so it can impact your ability to be able to manage your stress response. So I often tell people that we are all different, and what stresses someone else may not bother you, or vice versa, and we need to really honor that for sure. Um, but there are ways to deal, although we can't get rid of all those stressors in our life. There are ways to better deal with that stress response. And stress will, result in various different symptoms. It could result in a host of different symptoms. But as I said, it's very personal. And so for one person, it might be affecting their gut. So you may know people, or it might be you, where stress goes right to your digestive system. You start having, bloating, gas. You might go through cycles of diarrhea or even constipation, and that can be related to stress. But for someone else, maybe it affects them mentally, and it affects their mental health, or it impacts their sleep, or it causes muscle tension. Like for me, stress will impact me like up in my upper back, that I'll know I'm under a lot of stress then. And it's kind of like your body signal, like, okay, let's do something, get this managed better. And so this is a really complex diagram. I'm not expecting you to really understand it all here, but what I do want to point out is that there are different stages of what we call adrenal dysfunction. So these are imbalances in this whole axis from the brain, the pituitary gland, to the adrenal glands. And these adrenal glands sit over your kidneys, and they're the ones that release the cortisol and catecholamines like adrenaline or adrenaline. And what they do is, if they're constantly being stimulated by stress, you're going to end up with high levels of cortisol, and that can elevate your glucose levels and increases insulin, and eventually you can become insulin resistant, where the insulin hangs around your bloodstream too long. Your cells get resistant to the effects of insulin. Over time, that can start to change, and you can get, a lot of times when there's hyperarousal and you have high cortisol levels, you can feel almost wired all the time. But then when things start to almost deregulate, you can start to feel worn down or fatigued, which is what people almost what people refer to as adrenal fatigue. And there can be neurotransmitter imbalances that come along with that, all of that as well. So, as I mentioned, you can have an overactive HPA axis, or an inadequate HPA axis. There are ways of identifying this. So, we will use specific questionnaires where we can see where you fit on the scale based on all the physical symptoms that you're having. And then we can come up with the best sorts of treatment for that. And that can be, a lot of times we use herbs, and these herbs are in this category called adaptogens. And these are plant medicines that are meant to be used tonically. So they're used over a period of time to help improve adrenal function. And so for someone having elevated cortisol, for example, so elevated, so someone comes in and there's elevated belly fat that we identify, and then we've done blood work and the cortisol is elevated, then we're going to obviously go over stress reduction techniques and talk about lifestyle changes, and see where maybe we could, make some changes in routine, even to help lower the stress load of that person. And then we can use herbs to help regulate and improve the body's response to stress. And These herbs can come in a variety of different combinations depending on the entire. I don't want to just say, like, okay, you got elevated cortisol, take this herb. It's a lot more complex than that. There are some, you can look up lists of herbs that lower cortisol, but really the art of treating adrenal dysfunction is in using combinations of herbs to help improve adrenal function. And that's based on looking at the whole picture of everything that's going on with that individual. So stress, it's bad for you, but why specifically is it so bad? It increases blood sugar levels. It increases that deposition of belly fat. It also speeds up the aging process, and it's a major contributor to premature aging. It also changes how your DNA actually gets expressed, and that impacts all your body systems. So we really, really spend quite a bit of time talking about stress and managing stress and doing advanced testing for stress. As I said, you can test cortisol in the blood, routine tests that you would have done through your local lab, but there are some advanced salivary profiles that sometimes we'll do with patients to look at this circadian rhythm of cortisol production, because that can be altered. So somebody could be spiking in cortisol when they shouldn't. This can impact sleep. We should have more cortisol early in the morning, like kind of, that 7 to 9 a.m. range is where it's peaking. And then it should follow a nice pattern and get low overnight. But sometimes people will end up with cortisol spikes in the middle of the night, have dysregulated blood glucose that's causing that. That cortisol spike can wake you up. So it can get really dysregulated, and herbal treatments are a great way to get the cortisol regulated, as well as these other strategies. Yoga, walking outside, meditation, of course, fantastic, important way to help moderate the stress effects. And then sleep, of course. We need deep restorative sleep, and that's required for a number of different activities. So growth hormone is something that's released during sleep, and growth hormone is really important for muscle growth or muscle building. And as we get older, over 35, we're going to see a decrease in muscle mass over a 35 unless you're doing something. So you're actively losing muscle unless you're doing something, exercise, getting the right amount of sleep, eating healthy to keep that muscle mass up. And that's really important for your metabolism, and it helps improve insulin resistance. So we do need to make sure you're sleeping well to make sure we're getting growth hormone and muscle. Sleep is also where we repair and regenerate our body tissues. And so if you're not getting enough sleep, and for women, it's probably closer to 8 hours uninterrupted, of course. So that is critical to have this deep restorative sleep, maybe closer to 7 hours for men, but that varies. Some people can sleep 7 hours, women, and they're fine with that, but tends to be closer to 8, most studies show. If you're not getting that restorative sleep or enough sleep, it does impact appetite. It impacts your satiety during the day, and it has been shown to be associated with an increase in caloric intake somewhere on the order of 300 to 500 calories a day, which is significant. That adds up quickly. If you end up eating 500 calories extra a day, you'll gain a pound a week, and that adds up quickly. So we'll talk about strategies for addressing belly fat here just after this last slide relating to hormones. So I do want to talk a little bit about estrogen and testosterone. So when girls go through puberty, this is when estrogen levels go up, and that causes us to gain weight on our thighs, breast tissue, buttocks. That's where you're going to see a deposition of fat. And as you get older, that can start to change. So once you convert to being postmenopausal, then those estrogen levels decline, and it causes a redistribution of fat, basically. So now you start to see like fat all kind of sitting through the middle. So that would be the result of low estrogen. Now, interestingly, if you have a lot of fat, then you're going to be producing some like other types of estrogen, estriol from that fat tissue. That fat tissue also is associated with an enzyme called aromatase, and that converts testosterone to estrogen. But the estrogens that are produced can be these negative estrogens. So, someone with high insulin levels and um, fat in the midsection, that visceral fat, will produce more of this enzyme called aromatase, and they'll end up with less testosterone. So, now estrogen premenopausally can cause is not necessarily highly related to depositing fat in the midsection if it's estradiol, but the lack of testosterone being in the picture affects muscle mass, and it does this is how it leads to having an issue there. So those are things that we can test. So we can test estradiol, we can test estriol. This gets really complicated, and I've done another webinar all about hormones. I might repeat it again, but it does get incredibly complicated. There are many other kind of metabolites of estrogen that are dependent on liver function and gut health, and some of these metabolites can be influencing all of this as well. But bottom line, estrogen and testosterone can be playing a role here as well, and those hormones are something that then we assess as well when we're looking at belly fat. So I hope a lot of you stay hung around. I'm going to start talking a little bit about how to shed that excess body fat. Really, we don't have a lot of time left, but I guess you've probably gathered by now that we would want to address any of these hormone imbalances that are identified. So those are one of the first things that we start thinking about. So when someone comes into our practice, we're obviously doing a full intake, exam, getting all your health history on there. And then when we order blood work, you may have already had some blood work, but a lot of times it doesn't have all the hormones in there. So we would also test thyroid function. We would test estrogen, progesterone, testosterone. We would also then want to test things like cortisol and insulin, and we might test adiponectin and leptin based on your history. And we might consider genetic testing as well. We do a lot of that on our practice to come up with really good personalized nutrition program. We will also test for inflammatory markers. Now, I did say that you can see some of these markers that you can measure in the blood. CRP and SED rate are tests that we would run, but sometimes the bloodstream isn't showing up the level of inflammation, because you can have tissue inflammation. So it's not in your bloodstream, it's in your tissue space. And so if we're identifying, we can identify some of that through body composition testing to see if there's an inflammatory component where the fluid distribution is off. And then what do we think about doing for that? Obviously, dietary strategies are of utmost importance. There are very targeted supplements that can be used to help lower that inflammatory load, which is going to help with burning belly fat. And then full body red light therapy is fantastic. I'll talk about that in a minute for dealing with inflammation. As we get older, this is what I call the bitter truth in my last book. It's called The Bitter Prescription. One, one of the bitter truth I say is that we do have to consume less calories as we get older. We just don't require as much fuel. And so once, I can't tell you how many people have told me that since I heard this X age, 35, 40, I started gaining weight, and I didn't change anything about like how my diet was or exercise. And it is a product of changing metabolism. So what do we do about that? We track calories for a period of time. So we often use an app like MyFitnessPal, have the patient track their calories, and then we can determine on average like how many calories are coming in, and that'll help us decide how much we need to cut. Now, when we're cutting out calories, it doesn't necessarily mean that the amount of food you're going to eat will be reduced. It's more changing the composition of the diet. And we can do, I mentioned here, targeted and personalized nutrition programs. We do those anyway, but we can get even more specific by doing um, uh, programs that are based on genetic testing. Interestingly, caloric restriction, which is very low, that's a little bit different than what I'm talking about here, but it is a really low calorie diet, has been shown to increase lifespan in basically all the animals studied. And it also improved what we call health span, so your overall risk of disease. Uh, back to diet, I do want to point out that having foods in your diet that are what we call uh, phytonutrient rich in vitamins, rich in minerals. So a lot of these are like green leafy vegetables, nuts and seeds, berries. These types of foods are going to be uh, nutrient dense, but not calorically dense. So the calories are lower. That's going to be key. But what these phytonutrients do is they signal your cells to improve metabolism. So that's also really important, especially as we get older, to help us burn that belly fat. Metabolic detox can come in really handy when we're dealing with belly fat as well. I'll talk about that just briefly. But one thing with detoxification programs, they need to be not just laxatives. So we use more of what we call a metabolic cleanse programs in our practice, and that can almost achieve a metabolic kind of reset. But it does have the impact on the liver, and the liver is important for processing hormones, as I mentioned. That the hormone processing, a lot of that comes down to the liver. So insulin is important there. Also, the estrogen detoxification pathways happen there. And then, of course, as I mentioned, red light therapy. So this is the red light therapy unit in our practice. So it's called a Theralite 360. It's registered with the FDA for addressing inflammation. No harmful UV rays. I know it looks like a tanning bed, but it is one of the easiest and most effective ways to address inflammation without having to do any work. And it is something that we use for a broad range of conditions. So for athletic muscle recovery, it's also indicated for pain relief. Many studies, there's a psychiatrist up at Harvard using red light therapy for treating anxiety and depression. So there's so many different indications. People tend to come out of this machine feeling great. It's not like hot or anything. You do have a mild warming effect from it, but it is a fantastic way to address inflammation. And then with a metabolic detox, I want to talk about that just a little bit more. That a couple of other things that when we think about gut health and liver health is that an unhealthy gut can result in chronic inflammation. First of all, it's been associated with all these chronic health diseases. As I mentioned, it can cause hormonal disruptions. The other thing that we think about is that serotonin, which is your happy hormone, happy neurotransmitter, is produced and stored in the gut. The majority of it is. And people who have unhealthy microbiomes often experience, feeling depressed, unmotivated. Serotonin also can influence appetite. So if you've got dysregulated serotonin levels, low serotonin, that can cause you to be hungrier and especially craving carbohydrate type foods. And then the other angle of detoxification and metabolic cleansing is that when you are like burning fat, sometimes you can get plateaued, and it can be the result of toxic overload where you have all this chemical burden in your fat cells. So mostly where the chemicals that we're all exposed to or stored are in your fat cells. And then when we burn that fat, that stuff gets released into the bloodstream and it has to get processed by the liver. So a lot of times, we're using metabolic cleanse and detoxification support. Like it might not be, sometimes it's a full program, sometimes it's just targeted support to help support clearing those toxins out to help improve metabolism and continue with burning. So are really important factors to consider as well when you're dealing with belly fat and being on a fat loss program. So I hope you have gathered that it's really important to determine the underlying causes and correct those dysfunctions focus on treating those, not just treat the symptoms. You want to order the right tests. We do emphasize a personalized lifestyle plan. Of course, not one size fits all. And then we do think about definitely addressing the body as a whole. So it's not just like take this to burn fat and eat these foods. I hope you've understood that it's really important to consider the mind as well, minimizing stress, and of course, having a support system. This works so much better when everyone, if you have people in your household, are on board with the lifestyle changes that you want to make. And then again, to what do you want to consider is what is your why? Are you able to live your purpose? What is this interfering with? Do you want to be here for your kids, like my three kiddos there? What drives you to make these changes? And that will lead you on the right path. Here we go. We're almost at an hour, and my voice is starting to give out here. Let's see. So, if you're ready to make any sort of changes and you think we can help you, you can book a free call with one of our team doctors. So, either Dr. Clark or Dr. Bender, you can schedule a visit with right at the end of this webinar. There's going to be a calendar that will pop up. So, as soon as I go off here, that calendar can pop up, and then you can click a box and pick your time this week that you want to go in and have a 15-minute conversation to help them better understand what you're going through, what you've tried, what your health concerns are, and then come up with a plan of action for your first appointment. And then at your first appointment, that could be, so this call, obviously it's a call, but the visit itself, if you decide to come in and take on this change, you will want to make that appointment. You can do it virtually still, and insurance is covering that. We are covered by most insurances, so we are in network. I think we put it up there in the chat. We're in network with most insurance plans. And then the first appointment is a 1 hour comprehensive visit. So you really have nothing to lose. But what I do want to tell you is if you do choose to make that appointment, you're going to get a free body composition test. So hopefully you hung around to hear that. If you do choose to make that appointment and make that big step, you're going to get a free in-body composition test. That's that one we just went over with all that detailed information, and you'll get a good assessment of what's going on with your body composition. But you've got to make the call. So I hope this has been really informative for everyone. And probably going to do another webinar, probably on, I think I'll do my next one on weight loss resistance is what I'm planning. So keep an eye out for that next event coming up. And I hope you learned something tonight. And I thank you for your time. So hang on, you're going to see that calendar pop up if you do want to get on the books and schedule that free discovery call. Thank you so much.